So good evening everybody. Being the last speaker, I won't take much time. So coming to my talk on, is my post-operative protocol correct for patient undergoing cataract surgery who is having previously remains having a macular degeneration? Now, why so much extra care and protocol for these patients? We all know that cataract patient means anyone who is undergoing cataract surgery, we cause iatrogenic trauma, which starts a cascade of inflammatory reactions. And these patients with retinal pathology, they themselves have an eye which is compromised and inflamed. So a vicious cycle starts. So we should have a rigorous protocol for patient preparation, surgical technique, and post-operative control, which can help to minimize the risk of complication and achieve a good post-operative outcomes. Now, next question is, will the cataract surgery increases macular degeneration? Now, we have a discussion on this in the previous talk, so won't spend much time on this. Actually, some studies had suggested that wet AMD increases, but after a large population-based study by AIOC2022, which evaluated the patient for 10 years, they conclude that there is not much change, means there is no change in the incidence related to cataract surgery in AMD. So, the most important protocol pre and post surgery is the counseling. We all know all over the world, whoever is undergoing a cataract surgery, there was a high expectation post cataract surgery, means high expectation regarding the vision. They have a concept of like bang vision or what we call jackass vision. But we have to downplay this expectation. We have to assess preoperatively what amount of cataract is responsible for the vision loss and what amount of macular pathology is responsible for vision loss. And accordingly, we have to counsel the patient and decrease the expectation. We have to even counsel them that since you are having cataract, we haven't assessed your retina properly, so post-surgery will assess it, and maybe you may require photocoagulation depending on the pathology and the lesions, or anti-VEGF, or even you may require secondary this VR surgery. So you have to counsel them properly and give more chair time. That is the most important post-operative care, even pre-operatively. Next area of concern, like where we will deal in our post-operative care, is like some studies have suggested that there's slight increase risk of acute and delayed end-op in patient undergoing cataract surgery who had previous intravitreal injection or any other VR surgeries. Then second area where our care will be regarding anti-VEGF injection. And third, patient with severe macular degeneration whose vision is not improving, we can go for low visual aid like lighting magnification and reading aids. So since coming to this increased risk of acute and delayed end-op, we have to follow strict and over-suspicious post-operative vigilance in these patients with a history of intravitreal injection undergoing cataract surgery. This is the key to success. Now coming to intravitreal injection, means we have seen that there is no change in the schedule of intravitreal injection in patient with AMD pre and post cataract surgery. So the schedule will be same as it was before the cataract surgery. But eyes with suspected or confirmed macular membrane or cystoid macular degeneration or macular edema or other macular pathology, some retina surgeon recommends that you have to give intravitreal injection 2 to 4 days before surgery or immediately after the end of the surgery. But in this scenario, you have to have a good retina backup because you have to deal in case of severe inflammatory response. Then some suggest to give anti-VEGF on PRN basis, that is as and when required after 1 week of surgery. While few people have a suggestion, you can inject slow release intravitreal drug implant like Ozurdex or Retistud to control the inflammation. And in case of diabetic retinopathy, as the media clears, you can assess the fundus properly, and then you can decide on either you are giving anti-VEGF or panretinal photocoagulation or secondary surgery. Likewise, means after you properly assess the fundus. And in patient who is having a severe macular pathology and whose vision is not improving, we can ask for low vision aid, which is more beneficial once the media gets clear post-surgery. And this nowadays modern portable electronic devices have desirable properties such as flexible use of magnification. So to summarize, rigorous follow-up is essential to minimize inflammation post-surgery. And routinely this patient are put on topical steroids and NSAID, which is given for at least 3 weeks. But in this patient having macular pathology, we continue this NSAID treatment at least 2 to 3 months post-operatively, and we routinely examine the patient. And in patient who is requiring anti-VEGF, ideally we can give on PRN basis 1 week post-surgery or 1 month after post-surgery, and we can follow the patient in the retina clinic. Thank you for the patient.